Of course, I think we should identify exactly for which patient, for which question and for which patient subgroup we are using the investigations for. And in our trial, we only included patients that were PET positive, so that showed an enhancement in the PET imaging. We also had screened patients with PET who were the negative, did not have an enrichment in PET, and we excluded those patients. So for the diagnostic part of the FET-PET investigation, we cannot say anything. There are already a lot of studies that have shown that the PET investigation has a good sensitivity and specificity, and this is not challenged by our trial at all. We just looked at a question for the radiation oncologists, whether the volume would differ. And what we saw is that indeed the volumes to be irradiated are different in PET and in MRI. So they are not identical. They also do not overlap that much. However, if we look at the dose distribution, we did see that these volumes are quite in the vicinity of each other. So the doses, so there was a dose distribution to both volumes. I do think it's maybe for the oncological outcome not relevant whether you irradiate the one or the other, but for all patients we have performed multiparametric MRI, so a lot of sequences in MRI, and also the FET-PET investigation at diagnosis and also at follow-up. And we have a lot of images with which we can see whether these techniques have a role in some subgroups of patients.